Welcome to Mental Health in a Safety-Conscious Workplace. Our academic partner for this webinar is the CN Centre for Occupational Health and Safety from St. Mary's University in Halifax, Canada. Thank you for joining us today.
And in fact, in Canada, if we look at some stats, just in basic general stress, we have over 80% of Canadians reporting that they experience excessive stress in their day-to-day lives. In terms of disability, mental health, actual illness, and issues are the #1 cause of disability in Canada. We also have data showing that about a fifth of the Canadian working population at any time may experience mental health issues, which can impact their work. And we know that another stats, 500,000 Canadians in any given week are unable to work due to mental illness. So what is it that we can do? Because the good point is we also know that improved management of mental health in the workplace to combat stress and identify some of these other issues can significantly improve productivity and well-being of employees. And we like to think this is sort of the reality. We've got the group of healthy employees who are able to be resilient and get through, and then we have a group of individuals who may be suffering some issues at some point. But this dichotomous view of mental health is not helpful. And even some of the actions that organizations have taken, and I think of Bell's campaign of Let's Talk, which makes great strides at identifying, it really puts the onus on individuals of having to self-identify of being in this group on the right. And that's not the way reality is. And in fact, if you look at your life, it's more of kind of a process here. You have some better times and healthier times, and you might have some harder times and more difficult times. They might be little aspects of it, or it might be big. Now, hopefully, we'd like to see most of our employees and most of our friends and family sort of above the line, but we know that there's going to be that variability. And as you can kind of see on the left-hand side, I always refer to that as the teen years, where you're kind of like, you're happy, you're sad, you're happy, you're sad. And this is the way that we can progress from that. So if we look at it in this way, if we take mental health as kind of a longitudinal life view of it, and then we can always look at, we like to say with our Empower group, that all of us at some point in our life, we're all dealing with stuff. So another way of looking at this is if you look at the literature, we know that mood, attention, and fatigue all impact on safety. So if I'm in a bad mood, I won't be paying as much attention, and I'm also can increase my incidence of safety. If I'm not paying attention, or if I'm tired, the same ways I can have or more safety incidents and accidents. We also know that mental health is associated with mood, and improved mental health is associated with higher attention and with less fatigue. So if you improve mental health, you can theoretically improve safety outcomes in the organization. And the other aspect, of course, then are these work factors. So we know that there's certain work factors that impact directly on mental health. We also know this whole area of the culture of the organization. What does the organization and the leaders value? What do they do? That can impact both on safety and mental health at the same time. So the first basic thing, and I'm sure I'm preaching to the choir here, is that we need to recognize the importance of mental health for the physical safety at work. They are inextricably linked. So if we go back to our model that we have and really focus on what is it that we can do directly as organizations, as leaders, even as co-workers, what can we work on? We can look at culture, and we can look at work factors and changing those. And we can even do that in more detail by focusing on 4 different areas. And this is the IGLOO model. And that's really focusing on the I, the individual, the G, group, the leader level, and the overall organization. So as part of our Empower Healthy Workplace partnership, we look at how do we go about foster psychological health in a safety-conscious workplace. So that's sort of the overall goal of that. And to do that, we think about go to the individual. How can we support individuals? So if we're talking about mental health, how can we improve their mental health and help them develop resilience and skills to initiate healthy behaviors so that they stay healthy? But we also look more. It's more than an individual problem. It's a group issue because it's how we talk about mental health. It's how we treat each other at work. So the question becomes, how can we strengthen groups to support the psychological health in order to reduce stigma and promote health and safety? And then ultimately, we always look at the leader. So how do we develop leaders to help them support workers, strengthen these groups, and create this overall healthy workplace? Because they lead to all of the other aspects of that without the leaders. So we see them as playing an absolute key role in this work. From a mental and physical health perspective, we really need to shift our focus from just a tertiary treating the symptoms to a more primary prevention. So how are we able to change the workplace? How are we able to increase resources to employees and reduce unnecessary demands on them? And that is one of the key driving forces, it should be, for all organizational programs in this area. Now, so that's a great start, but it's not enough, because no matter what you do in an organization, no matter how perfect you are, there's always going to be demands and there's always going to be stuff happening. So we also need secondary interventions in there, and that's really looking at how are we developing the resilience in our employees? How do we help them cope with what's happening at work or in their other aspects of their lives? And so that when stuff does come across and they're dealing with that stuff, they're in a bit better position to handle it. And then we go to the treat the symptoms. So we should never totally ditch the treat the symptoms, but we need to have that in there to show as that tertiary place, that occasionally, even after we look at primary and secondary, things may happen and we need to have supports for our employees, and including leaders and groups, to help them deal with all of those. So we talk some on health aspects, and this is just a nice diagrammatic from Australia that I like to use and kind of show. When we're looking at health, taking again this overall holistic picture of it, and people typically know that you need good sleep, have a healthy diet, and get plenty of exercise in order to be healthy. So we're fairly clear on those things. We don't always do them, mind you, but we know that we should be doing that. When it comes to stress, however, we sometimes are left in, well, what do we do with this? How do we reduce the negative demands and stressors in our life? Or how do we help cope with those things? Now, the good news is, if you are doing these other three things, getting good sleep, eating well, and being active, that in itself can have a positive impact on your stress level. There's that may not be enough, though, and there's other things that we can look at to reduce the ill effects of stress. So when we're talking about supporting mental health and safety at an individual level, we can offer programs looking at values. So we talk a lot about what individual values are, how they're aligned with the organization, and how they're aligned with your own behaviors. So if your values are aligned with your behaviors, even if things happen, you at least know you are moving in a positive direction. But the group initiatives can have as big an impact on well-being as these individual initiatives and interventions. So really looking at how individuals interact. The thermostat example here, as you see the little icon here, is really about perspective taking and developing empathy. So a lot that we see in terms of conflict at work, about not being supportive of people with maybe some mental health issues, or just generally unsupportive, is giving them some skills to be able to take the perspective of others. As a group, it's also how we talk about mental health and how we conceptualize it that has huge impact on how we are really valuing the individuals and treating individuals with mental health issues. So these series of pictures are really interesting because it shows, so what if we talked about mental or physical health the same way that we talk about mental health? And so, for example, yes, you see, you just need to change your frame of mind, then you'll feel better. Another one, as somebody's sick, have you tried, just not having the flu? And again, it's like you're not even trying. And finally, I get that you have food poisoning and all, but you just have to make an effort. So these are all things that we say about mental health. So have you tried not being depressed? I get that you have social anxiety, but you got to at least make an effort by going through, whoops, sorry about that, by highlighting that, how we talk about mental health in the workplace or anytime really emphasizes how we think about our colleagues. And if we can take away that language and that stigma, then we can create a much more inclusive, much more supportive work group for them. Looking at LEAD, which is leader effectiveness and accountability and development, leading healthy workplaces, or MHAT, which is mental health awareness training. So all these training programs look at how do you help in the MHAT one, how do you help support leaders identify when maybe things aren't okay with their employees, and what steps do they take in order to ensure that that individual feels supported and gets help. The Leading Healthy Workplaces really talks about giving leaders the skill to deal one-on-one and as a group with their subordinates, direct reports. And as you can see from some of the aspects here, about the support, how are they demonstrating their support and care? How are they communicating effectively, providing feedback, involving those employees, and promoting a healthy workplace? And I think the one thing that we do see is that employees don't want to necessarily be a poster child for any physical or mental health issues. They don't want to have to come forward and say, okay, I'm suffering from depression, or I'm suffering from a chronic disease, and I'm going to be open about this in my workplace and get accommodation that way. A lot of them are wanting it as a much more subtle or much more quiet process. So this is where having this supportive culture can be very effective. So to show that that they can help individuals without it being a burdensome effort on the individual to come forward. And what we see here, so artifacts are all of those things in an organization that we can see or read and that are visible to us. So they may be our mission statement, they may be the healthy workplace initiatives, it may be our EAP policies or programs, it might be training, it might be benefit packages. It could be the physical work environment, how the offices are set up. All of those things we make assumptions about the organization based on that. But what drives those artifacts are these underlying values. So we might have all of these initiatives. We might have some wonderful training packages. We might have a great EAP program because we value worker health and safety. We value their ideas and input. We want them to be healthy and safe. We also might have them, if I'm being cynical, we might have them because we want to make sure that we just recruit the best people. We might want them to make sure that we don't have any charges against discrimination on that. We might have safety policies in there because we don't want to pay we value money too much and we just don't want to pay if somebody gets hurt or killed on the job. So the value, the artifacts may look the same, but the values can be very different. They can be the positive way in terms of the valuing, we actually value our employees, or it may be there for other reasons. The basic assumptions are the underlying assumptions we make about life, about humans, that we don't ever question. So people are inherently good, workers are inherently productive if left on their own. Respect and compassion is integral to relationships. We rarely question these things, but they drive our values. So overall, at an organizational level, even though we have a lot of demands on us and workloads and rural conflict, our job as leaders and our job in organizations is that we try to minimize all this bad stuff. So you hear about toxic bosses, I just call them unskilled because they haven't had the training to be better. So how do we minimize those, have good leaders, minimize the overload so it's manageable workload, and how do we leverage all these positive things about giving work as being meaningful for individuals, having that positive social support and leadership. So as some take homes here in terms of what can you actually do? I wanted to use my BUILDS acronym to help you think about building a mental health and safety strategy. And that the BUILD stands in for buy-in, understand, the initiatives or implementation, learning, and developing sustainability of those. So if you are interested in developing such a strategy, the first question that you have is the buy-in. So do your key stakeholders actually believe in the values of mental health and safety strategy? Do they believe the evidence that's out there that shows that mental health is an important workplace concern and can impact effectiveness and well-being and at an individual and organizational level? So if your answer is no, this is kind of your action place. So you can identify the data and evidence out there. I would say go to universities, find individuals doing this. People like me are always happy to share what we know with organizations and the data. And then are you able to develop that awareness? Are you able to develop documents and showing this and having information sessions for your stakeholders? I will have the caveat here is if your CEO or owner and all of that, if they have power, especially if you have an owner CEO where they're not going to get turfed, if they really don't buy into this and they don't really care and they don't really value mental health or safety in that, you are going to have a big struggle on your hand. This is not going to be easy. And some people have talked to me and I'm like, at some point I'd even say, if they're not going to change and this is important to you, go elsewhere. Pack up your bags and you can be of much use to another organization who actually realizes the power and their maybe moral responsibility to employees. Now, if you're in the happy category to say yes, they do buy this, then we get to go to step 2, and this is the understand. So a lot of organizations kind of stop there and say, but do you know what your current situation is? So in terms of what does mental health in your organization look like? What are the issues? What are your employees dealing with? And do you know where you want to be? So again, no, if you don't know any of these situations, questions, then go back, collect, review your own data. So this could be the human resource data that you may have. It may be some organizational survey data. What is important to your employees? And then and share data with stakeholders, and then move forward to step 3. Initiatives. So this aspect is, do you know what initiatives that you can implement, or do you know the effectiveness of your current initiatives? So if you're at the no stage here, then again, remember that IGLOO we talked about, the individual supports that you can look at, strengthening the work groups, developing leaders, and of course the overall organization. So there's things that you can do at each level to bring that up. Ask your stakeholders what's important and to them, and connect with the values of the stakeholders and the overall organization. That is your best way to ensure that sustained buy-in and moving forward. So then once you have that in place, you can implement, and then we go to step 4. So this is the L, the learn of it. So have you assessed whether anything in your organization, whether these initiatives are actually helpful? And a lot of organizations, if you say no, you're not alone, because I'd say 90% don't do much, if any, in terms of program feedback, what works, or surveys, or more systematic assessments of whether these things actually worked. So are we able to improve mental health, improve safety using these initiatives? And then you can say, yes, if it was helpful, you actually do know, and it was helpful, move on. If not, so yes, you do know, but the things you're doing are not very helpful, you need to go back to step 2, kind of review where you're at, and develop new objectives and initiatives. So the last part of this model is really looking at develop the sustainability. So do you have a plan to ensure that your mental health and safety strategy is sustainable? If no, and again, don't worry, you're probably up with like 95% of all organizations. Things that you can think about on this are looking at incorporating strategy values into your mission. So once mental health, safety, employee well-being become key words in an organization's mission statements, then you're always aligning. You're always making sure that your behaviors, the organizational behaviors, are aligned with that mission, vision and mission statement. Identify the stakeholders who can support the strategy. So who are there that are keen on these aspects and are able to see them through, again, as part of their job, as part of their mandate, as part of their passion and their values. And if you said yes to this, then great. Repeat your steps as necessary, as required, and move forward through that. So mental health is necessary for physical health, and vice versa. We can't simply focus on one and don't think it's going to impact on the other. Think about IGLOO as a good acronym. We can help improve workers' physical and psychological health and safety, so their mental health, by not only supporting them directly, but strengthening those groups, helping our leaders, developing leaders that way, and doing for the overall organization. Sorry, didn't put that in there, but it's there. Remember that the values that we have, those are not the artifacts, are key to success. So if your organization is constantly putting out wellness initiatives or constantly doing that, but they don't really have those underlying values of it, then you're always going to be struggling to try to make it successful. So that may require some challenging and really assessing in terms of what the values are.